Good evening. My name is Frederick Timbrook, and tonight we will be discussing The Great Physician, an ethical approach. Here we will combine how our personal relationship with Jesus Christ can be related to ethical practices in Western medicine. Medicine is both a sacred and a time-honored tradition that has lasted the test of time. Of course, verifying Norheim of the biological journal Bioethics mentioned that it is ethical standards that have allowed medicine to prolong through the nation's history, especially in the United States. Leslie Gelling wrote in an article in the peer-reviewed journal Nursing Standard that two ethical principles, patient autonomy and respect for patient autonomy, and also patient confidentiality, strongly contribute to Western medicine's successful practice. Of course, you might be wondering, how does medicine relate to God? First, you consider that God allows people direct choice whether or not they want to have a relationship with Him. And second, also consider how our prayers and concerns are personal and confidential between us and God. Of course, these two topics may be confusing, and you might not see a direct connection between the two of them from the beginning, but I hope that as we go in further into this speech, it'll become clear for you. First, we will discuss ethics, the two ethics that I mentioned, and we'll go into greater detail. Next, we will discuss how ethics are compared to morals, and how ethics are not morals, however they are closely related. Third, we will also define how God's relationship with man is similar to a code of ethical standards practiced in Western medicine. The first ethical standard we will discuss is patient autonomy. Patient autonomy is the right of the patient either to choose or to refuse medical care. Of course, this also includes medical clinical trials, which is clinical testing and also scientific experimentation. This is a very common theme in Western culture because Western culture, especially United States culture, highly prizes the right of the individual to choose or not to choose, and in this case, to choose what to do with their body. This is a very sacred sentiment of United States history. The second ethical standard we will discuss is confidentiality. Confidentiality is that information shared from the patient to the physician is kept secret only in the case in which the patient is either going to harm themselves or harm another human being. Can the physician rightly divulge that information to another person? Consider this example. If a person consumes too much alcohol or participates in the use of marijuana use, this person has negative side effects on their self. However, they are not negatively affecting another person. Therefore, the physician keeps patient confidentiality between the information exchanged. Take, for example, the situation in which a man contracts HIV. This man has cheated on his wife, and his wife is then now at risk for HIV. However, the patient tells the physician, "I'm not interested in referring to my wife that I have contracted HIV." At this point, the physician not only has a duty to the man for his personal care, but also a duty to the wife to protect her personal care. At this point, confidentiality can be broken because a secondary individual is brought into the picture. Now that we have discussed two ethical ideologies, let's turn to what ethical ideologies are and are not in comparison to morals. The difference is technical, meaning that it's a very small detail that defines the difference between the two of them. Ethics concern social constraints and parameters placed by the general society on a certain practice of human behavior, in this case, medicine. Ethics are neither personal, nor do they reflect a religiosity or a religious belief. Of course, morals, in contrast, reflect personal interests and personal perceptions of right and wrong, what is good and what is evil. Of course, this kind of refers to our sense of conscience and also can have great impact or can also relate greatly to our personal standards regarding religious beliefs or also the social environment that we were brought up in. Of course, I do understand that morals and ethics being so related can kind of be difficult to differentiate. Therefore, I have a figure I'd like to demonstrate that will show the difference between ethics and morals in medical practice. In this picture, I'm given here to checking the vitals of an African child. Here, the initial response is, "Oh, this is a good thing. You are doing something good for a third world country." However, my first question is this ethical? Now, your first answer may be, of course it's ethical. However, I would like to point out that this is not an ethical situation. Patient confidentiality is not respected because the patient, being this infant here, is exposed to all these other patients in this building. At the same time, patient autonomy is neither respected because these patients, while they are engaging in medical practice, there is no official right to receive medical treatment per an expert. Since I am no expert, this is no respect for patient autonomy. This is not an ethical situation. However, you might be wondering, but why do I feel like this is a good thing? Why is this a good situation? Well, the answer is, this is a morally good situation. Your morals are your intrinsic values. They're telling you, this is a good thing. You're doing something positive. Therefore, while this may not be an ethically right situation, it is a morally good situation. Now that we have discussed what ethics are and what they are not in comparison to morals, let us make the relationship between a relationship with God and also medical ethical practices. First, God is a God of relationships. In this sense, your prayers and your concerns are confidential between you and God. God shares your concerns, and God also cares for your worries. In this sense, the information exchange between the two is confidential. Of course, he may intervene if you might engage into some behavior that might negatively affect you or another person in his divine foreknowledge and his divine foresight. God also respects your choice whether or not to have a relationship with him. In this sense, this is very similar to respect for patient autonomy, because you get to choose whether or not to fellowship with God. Now, I do hope that now that we have proceeded through ethical standards and also through a relationship with God and how the two can relate, that the connection between the two concepts is much clearer and connects more seamlessly. The conclusion is this. The two most valued ethics are patient confidentiality and also respect for patient autonomy. God relates to these ethical systems in the sense that God also concerns himself for our concerns, and our prayers are kept secret and confidential. But at the same time, God also respects whether or not a person has the free will or chooses to have a relationship with him. In this sense, I think it's very clear that you can take two subjects that are seemingly unrelated and find a connection between the two. In this way, if we take a little time to investigate two concepts or one concept, we can see the goodness of God in all things. Thank you.